So the next question came in saying thoughts on nurse to MD. And the thing to keep in mind with going from nurse to MD is this is definitely something that happens sometimes. There are successful medical school applicants who are coming from the RN world and are ready to transition into medical school and practice as an MD. The main thing to keep in mind is that if you are not yet a nurse, it's not beneficial or detrimental to have or not have the nursing background. The schools don't automatically assume that you will have poorer clinical skills if you don't have the nurse training. And they don't really assume that you'll have better clinical skills if you do have the nurse training, just because the role of nurse and doctor is a little bit different. The other thing is you do want to be prepared for two things. One is demonstrate mastery over the MD level educational entrance components. So good GPA, solid MCAT score, but be ready for a little bit of a different set of questions than most traditional MD applicant students would have. Namely, get ready to succinctly and clearly answer the question of why you want to become an MD now and what you discovered in your RN training or in your RN practice that convinced you that that was not the best role for you. And they want to hear a really clear articulation of why you feel like it's worth it now, having already achieved a provider status and having already completed a graduate level additional education that you now want to go back into the educational environment. And so as long as you have a good, clear, concise way of verbalizing that to your interviewer and a good way of narrating that in your personal statement, then you should be golden. But do be prepared for that because it's not something every student is used to.